Hey, listeners, we have an event coming up. I cannot tell you how excited I am. On April 16th from 1 p.m. to 4 p.m., we are hosting free treatments. We have the BTL bus coming to our office located at 9325 Glades Road. There's going to be a big bus. Not only are we giving away free treatments that you can call our office and get signed up for, we are going to be giving away demos, raffles, and other exclusive offers. Discounted prices. Everybody loves that. So come check us out. Like I said, April 16th from 1 p.m. to 4 p.m. to get a demo of either the M-Cella, the M-Face, or the M-Neo. And welcome back to another episode of Hybrid Healing Hour. Today, we are going to be talking about how aesthetics tie into wellness. And we have a very special guest with us, Sarah Hayden. I'd love for you to introduce yourself and tell everybody how you got to where you are today.
Sure. Thank you. I'm very happy to be here today, by the way. So my name is Sarah Hayden, and I am the practice development manager for an aesthetics company. So BTL Aesthetics makes non-invasive, no downtime devices, some of which you have in your practice, right? So we are going to talk a little bit today about all of those devices and how they tie into both the aesthetics and wellness health world. And my background is aesthetics completely. For the past 20 years, that's what I've been doing and working with doctors like yourselves to really build aesthetics into that wellness and health journey. So excited to be here.
Awesome.
And this is interesting for us because we are so non-aesthetics, and our practice has always been based on wellness and from the inside out. And it's been a unique journey for us too, to start incorporating newer things into our practice. And we do see a reason why it fits in. Now, BTL is a huge company, right? They don't just make aesthetics devices. They make devices on almost everything.
Yeah, you're right. Actually, the company started out with cardiology and physical therapy, and really the crux of BTL is muscle. So determining how to move muscle from an electromagnetic therapy standpoint and how that can benefit the body overall. And with that naturally segmented over into aesthetics from, again, a cosmetic perspective, but then we have all of these health and wellness items that go along with it. So it started out cardiology, physical therapy, and has moved naturally over into aesthetics. And so you'll see kind of that pathway along with the devices as we talk about them.
And Deanna has said it before, and I think you'll hear it many times on this podcast, that muscle is the currency of health. Mm-hmm. And so that being said, why don't we start with what we consider to be the flagship device, at least in our practice, the M-Sculpt Neo.
Yes, absolutely. And I love that you're putting that importance on muscle, because it really, really is the entire structure of our health and well-being, right? So M-Sculpt Neo is a non-invasive device, no downtime, kills fat, and builds muscle at the same time. We can treat basically any body area besides the face and chest. So abdomen, glutes, thighs, love handles, calves, arms, you name it. Again, to build muscle, 25% more muscle, in fact, and to kill fat, 30% of the fat in the treatment area on average. Pretty incredible. And we know that the benefit of having more muscle, less fat, and less visceral fat is so important to our health. Maybe you can speak a little bit to visceral fat and what that is and why it's important.
Yeah, no, absolutely. Visceral fat is something that we measure with our body fat analysis in the office. And visceral fat is the fat you can't see. Visceral fat is the fat that surrounds your organs, that's around your intestines, in your liver, and that's the bad fat. That's the fat that causes disease like diabetes and heart disease, right? And so one of the first things we look at when we look at the body fat analysis report is the visceral fat. And until this, I don't think we've had any significant way of reducing visceral fat other than if you lose enough weight, the visceral fat will go along with it.
Right.
But this is one of the few devices that actually targets visceral fat.
The only, actually. Yeah. So you're right. With visceral fat, the only way of getting rid of it really is diet and exercise, right? Your traditional ways of losing weight. But liposuction and other body contouring devices cannot get to that visceral fat as it's behind the muscle. So that's one of the things that makes M-Sculpt Neo unique. Also, like I said, building that muscle and killing the subcutaneous fat, or that fat that's just below the skin. So we have this idea of the way we look and feel in the mirror, but also our overall health. by killing that fat, building the muscle.
And there's a lot of misconceptions about the device too. And I hear this from doctors who say to me, so it's just a big TENS unit, right?
Right. And
I couldn't be further from the truth.
You're right. So how does Sculpt Neo work? So we have two different technologies happening at the same time. We have an electromagnetic therapy. It's called high intensity focused electromagnetic. The important part is the electromagnetic that's stimulating the motor neurons of the muscle, helping to contract the muscle essentially 20,000 times in a 30-minute treatment. So if you can imagine doing 20,000 crunches or squats or curls, that's what's happening.
It's phenomenal.
It's incredible, right? And so a TENS unit is really sensory layer, right? So it's speaking to those sensory nerves. It's helping to, quote unquote, numb the sensory nerves so you feel better, but it's actually not doing anything for the muscle at all. So this electromagnetic therapy, getting down to the muscle layer, rebuilding that muscle. And then we also have radio frequency, which heats up the fat layer, and those fat cells naturally die in something called apoptosis. Most people have this idea that we get more fat cells the more weight we gain, but the reality is we're born with all of the fat cells we're ever going to have. They just grow and shrink. So Sculpt Neo actually being able to kill fat cells is not something we can physically do on our own, and makes it really incredible that way.
So with when you do crunches, right, you can't target all those muscles, which is the other thing we found fascinating, is this actually gets muscles that you don't actually work when you're exercising.
Yes. And not only that, but we can only contract our muscles so much. You know, if you think about asking your arm to spasm, you can't, right? Your brain won't let you. And so Sculpt Neo can utilize 90% plus of the muscle's capacity with every contraction. Whereas typically when we go to the gym, we work out, we're anywhere between 30, 40, 50% of the muscle's capacity. So yeah, we're exercising all of these unique muscles and exercising them in a way that you could not do on your own, and certainly not 20,000 times.
Well, and speaking of that, then you would think, well, if I'm going to sit there and do 20,000 crunches, I'm going to be sore and not be able to move the next day.
You're right.
But you guys built in the technology to remove the lactic acid.
Yes, to flush it out of the system. So that way, after a 30-minute treatment, the next day you might reach for something and go, oh yeah, I feel like I did a workout, but certainly not 20,000 crunches worth. So we keep you nice and comfortable throughout the treatment and then in the days after as well.
And hence the no downtime. You literally could hit the gym after a treatment.
Go for it. Yeah. Absolutely.
So
go ahead.
No, I was going to say, who cannot get a treatment?
Yeah. So with Sculpt Neo, we want to be careful of a couple of things. One being any electronic devices in the body, metal in the body, pregnancy, breastfeeding, some of your basics. But for the most part, everybody is eligible for this treatment and everybody's going to benefit from it in some way. So we have people who may benefit because they have lower back issues. And so we want to build that core and keep them really nice and stable around the spine. We might have someone who, again, wants to feel a little bit better in their bikini, someone who has undergone liposuction or a tummy tuck but wants to lose fat in their inner thighs. We have all of these opportunities to really be thinking about who is best for this treatment. So with that being said, why don't you tell me a little bit about why you brought it into your practice and how you saw it fitting in with your patients?
So we're all about health. We're all about getting people healthy in any way that we can, and we're not opposed to using our artificial means to do it. So we brought in weight loss medicines like semaglutide and tirzepatide. People started losing weight. And what happened when they started losing weight? They also started losing, in some cases, some muscle, but also they started noticing, hey, I don't look as good as I did before. And so when we treat people, we're also treating them psychologically and mentally. And aesthetics is not just about looking good. It's about feeling good and getting yourself in a place that you're happy with yourself, because at the bottom line, it's all about quality of life. You know, we can live to be 100, but does that mean we have a great quality of life until we're 100? So right. Dan and I have both used this machine on family members. So my father, who is not out there to get a, six-pack abs, has back problems.
Right.
So, and he also has problems with his legs. And so we've put him on the machine and he noticed a difference. And you've also.
Yeah, he could actually stand better. I noticed the strength in his legs was a lot better. And my husband, he had ACL repair years ago, and he works out regularly, hits the gym, but he noticed his left leg was always weaker slightly than the right leg.
Sure.
And now he can actually do a pistol squat, one-legged pistol squat with his left leg after doing some treatment on the quads.
Yeah.
And so it's just amazing. He feels like he has better consistency between both legs now.
Incredible. So so we've got two different opportunities here, right? Someone who maybe having a little sarcopenia, having some trouble standing straight or walking very well, and again, building that core or stabilizing the pelvis with Sculpt Neo. Someone who's post-surgery and needs that strength back.
Exactly.
And let's also talk about metabolic improvement if we can for a second. So what does it mean when we have more muscle and less fat? What does that mean for our metabolism overall?
Shoots up. People, it definitely increases metabolism.
And helps with insulin resistance.
Absolutely.
Because muscle is the underlying cause of insulin resistance, lack of muscle. And we've really shied away from the term aesthetics. Mm-hmm. We don't use aesthetics in our practice in the same way that other people do. We don't do injections. We don't do Botox. We don't do collagen. But this is beyond that.
Right.
So this is something that I believe that there's, like you said before, there's no one who couldn't benefit from having more muscle on their body.
Absolutely. Absolutely. And so this is a great tie-in to a lot of the things that you're doing. Like you said, the semaglutide. If we are losing some weight on semaglutide, we might also be losing some of that muscle volume. And so rebuild that muscle volume, kill some more fat, kill fat actually, because semaglutide's not killing fat, right? And so then that again increases our metabolism. And so we're just creating this incredible cycle within the body of losing weight and being able to keep weight off and building that muscle back up. So we've got some great things happening with Sculpt Neo.
And you also mentioned a diagnosis that we use a lot in our practice, which is sarcopenia. Mm-hmm. We read notes from other doctors all day long, and I don't think I ever see sarcopenia mentioned in anybody else's note.
Really?
Right?
It's always mentioned BMI, which is, we already know, and we talked about this on several podcasts before, that a BMI is not a true story that based off the scale.
Right.
So you can have a bodybuilder have the same BMI as a man, same age, same height, but obese, and it's all fat, right? So BMIs are not accurate.
Yeah, I've noticed that too, that also with BMIs, people carry their weight in different places. And so really understanding someone's body holistically, and as you're saying, psychologically, how everything is tying into their overall health and wellness journey. And so how aesthetics can play into that, and how Sculpt Neo, again, can be used for aesthetics and health and wellness.
Right.
So.
I mean, the one body part that I like that you guys also have is I have guys who work out regularly. They're fit and they're strong, but they have the back fat right above the belt, and it's just not getting any better.
Yeah.
And that's an area that you cannot work out. It is really hard to keep that tight. That is mostly diet, but even loose skin can get there. So with the Edge applicator, you guys melt that, tighten it, and it still works on the abs at the same time. It's actually a phenomenal technology.
Yeah, and so that's very true for men. They get this little bubble right above the pant line, as you're saying. For a lot of women, it's the lower abdomen area, especially after having children. And speaking of children, we have diastasis, the separation of the abdomen that can be treated with Sculpt Neo, but a lot of these things can be hormonal or genetic. And so it feels like no matter what you do, no matter how much you exercise, no matter what you eat, you can't get rid of these stubborn areas. Yeah. And so the difference here when using a technology is that, especially Sculpt Neo, we're actually speaking to the cells. We're speaking to the muscle. We're speaking to the fat cells. And so hormones and genetics at that point don't matter, right? So we're actually able to treat those stubborn areas.
Can you tell our audience how long these treatments last for?
Yes. So each treatment is 30 minutes. So it's really, really quick and easy. And you're doing once a week for as many sessions as makes sense for your body and your body goals. Now, the good news is that the fat cells, they're dead, gone, removed from the body. That's it, right? Now, we have remaining fat cells, so we want to make sure that we maintain a healthy lifestyle, but those 30% of the fat cells, gone. The muscle is proven in all of our clinical studies to last for up to a year before it starts to decline. And then we recommend coming in for touch-up treatments here and there, but you're getting this incredible longevity by getting just a few treatments with Sculpt Neo.
Right.
And can we also talk about the different areas that we can target and the different paddles or applicators that we can use?
Yeah. So like I said, we have abdomen. We can do the love handles, glutes, inner thighs, outer thighs, back of thighs, front of thighs, calves, triceps, biceps. And we do have several different applicators that form to that body part in particular. And each body part has a different protocol built into the machine to make sure that we're stimulating the muscle properly. So the way that your glutes work out, as if we're stimulating a squat, we don't want to do that on the abdomen, right? So every area has its different protocol. We may not want to kill fat in certain areas. We may want to really target fat in certain areas. And so every area is treated individually.
Okay, so moving on to the next device, and which is the second favorite device in our office, which is Emsella. Emsella is unique. This is definitely not aesthetics. This is about as far away from aesthetics as you can get. But we love this device, and actually we've seen this device popping up in more and more providers' offices, especially gynecologists and urologists. So why don't we talk about Emsella?
Sure. So Emsella, EM for electromagnetic. So we're talking about that again, stimulating the muscle, and Sella, Latin for chair. So electromagnetic chair to stimulate the pelvic floor. The pelvic floor is used for many, many different things, but this device in particular is FDA cleared for the treatment of urinary incontinence. Non-invasive, no downtime. So any of you out there who have looked into getting treatments for urinary incontinence, there's poking and prodding, there's removal of clothes, there are things that are unhappy, surgery, you name it. And so to be able to actually go somewhere, take a seat on a chair fully clothed for 28 minutes is incredible. So this is stimulating that pelvic floor. Again, we're inducing a little over 11,000 muscle contractions in that 28 minutes, and that's going to help rebuild the pelvic floor to help us stop when we want to stop.
So it's like doing a Kegel.
Essentially, yes. Which most of us can't do
Exactly.
properly.
People don't realize how hard it actually is. And a lot of people don't realize that men and women can do Kegels.
Absolutely.
And they should be doing Kegels. And especially anybody who has had, nearly every female, I think, who has given childbirth eventually feels or sees the effects of that through incontinence.
Yeah. So incontinence is caused by many different things, right? Childbirth being a very common cause. But hormones, postmenopause is very, very common as well. Obesity is the leading cause of incontinence. And then we have some other, medical issues that may pop up, and we can talk about those. But both men and women suffer from incontinence. By and large, women more often just because of childbirth and because of gravity and certain physiological traits. But everybody suffers from incontinence, and typically below the age of 65, so anybody under the age of 65, we're looking at 1 in 4 women with incontinence.
Wow. Over
Over the age of 65, it's 3 in 4 women. So we're talking about a lot of people who are having this issue and suffering from incontinence. And quickly, I'll talk about, you say psychological and emotional. This has got to be one of the most emotional things that women go through on a daily basis. Not feeling good in their clothing, not feeling good about themselves, or they're at their kid's soccer game and have to wonder where the bathroom is, and just not being able to fully live life without thinking about the bathroom.
Yeah.
Well, and so for the audience out there, incontinence is loss of bladder control. So imagine, this can be quite embarrassing for some people, and a lot of times people don't want to talk about it.
Right.
But I talk about everything with my patients. So this is something that I like to know so we can help you. There's no reason you need to continue to worry about this or fear. Like, there's people who don't leave their house because they're worried they're going to have leakage, or if they sneeze or cough or jump or get scared, you can have some leakage, urinary leakage. And women have to wear pads because of this, or there's even, adult diapers. I don't like saying that word, but, underwear. And this is something that can, if you don't change it frequently, can lead to urinary tract infections. We see that a lot. And so I love this because I can help my 65 and older crowd as well as my young crowd. Like, it's a treatment for everybody.
Yes.
And even those who are on tons of medications, I don't have to worry about the possible side effects. This is no pills. It's nothing. And I have other patients who have gone and seen their urologist, and they're talking about getting Botox. And I'm like, I'm sorry. I've gotten Botox on my face before. It does not feel good. And to imagine that being shot down there is a little scary. And there's possible side effects with that. That is not completely benign.
Right.
if you can have brow droopage or eyelid droopage on your face, imagine what can happen down there, So this is something that's so easy and comfortable.
Yeah. And again, it all comes back to the muscle, right? The pelvic floor muscle. A common misconception for people who have incontinence is, I have a weak bladder or I have a small bladder. That's not true. You just have a weak pelvic floor, which is a muscle that kind of hangs like a hammock from front to back. And I call that muscle the brake pads of the body. So if you can imagine driving your car, the brake pads wear down, it's harder to stop, right? So that's exactly what's happening. And we just need to rebuild that muscle and make you stronger. And so that's what exercising the pelvic floor will do for you.
If I remember right, this has a very high satisfaction rate too, right?
Yeah, you're exactly right. So pretty much all of the other options, again, surgery, Botox, there's a manual physical therapy for the pelvic floor. No, thank you, in my opinion. But all of those, we're looking at about an 80% success rate or 80% patient satisfaction. So doing all of those things, including surgery, 1 in 5 people are not seeing results. That's incredible. So with Emsella, we have a 95% patient satisfaction rate, meaning 95% of people see a drastic improvement in their everyday life.
And it's just a few simple treatments, right? Yeah. So it's recommended to one session twice a week for 3 weeks. So that's a total of 6 sessions, and it's 30 minutes sitting on a chair, and that is it.
That's it.
And I know I have actually had people not urinate as frequently in the night for this, or they're able to hold their bladder through the night, so they're not getting up as often, so they're getting better sleep. Yes. And I mean, I'm not saying this is treating overactive bladder, that's different, but this can strengthen the muscles to hold the bladder.
Yes.
So,
and if I read right, it also has benefits on sexual health as well.
Yeah,
right?
yeah. So there's some happy little side effects that happen when we stimulate a muscle, and that's increase in blood flow. And so we do have a couple of different protocols with the Emsella. We can treat specifically incontinence, or we can treat for prevention of incontinence, but we can also treat from a sexual health perspective. And so increase in blood flow from a female-bodied perspective means increase in sensitivity, elasticity, lubrication. And for male-bodied people, the blood flow is the entire function of the erection, right? So being able to actually increase that blood flow naturally can get us away from medication or injections or other options that both men and women seek out for sexual health.
So I know that before we got this machine, we tried it out. We sat on it. And most people think it's going to be painful. It's not. It feels weird, but it doesn't hurt at all.
Yeah. It's very, very comfortable. It's strange for sure, but it's comfortable. And you mentioned something that I want to touch on really quickly, Deanna. Your patient's 65 and older. So the number one time that patients fall, the elderly patients fall, is in the night trying to use the restroom.
Exactly.
And we know that once a patient of that age falls and, say, breaks a hip or gets injured in some way, the longevity of their life is severely shortened, right? And so this is another way to actually prevent these falls and to extend our lifeline. So can you tell me how it fits into your overall catalog of care when you're looking at patients holistically and what your patients look like, Deanna? Why Emsella?
Right. So that's exactly the reason I like how this is not just for a certain age group. You can do this for young. I have a 40-something-year-old who has incontinence and noticed improvement after 1 session, and then continued getting and just completed all 6 sessions. And she's so thrilled. She's actually she's done Kegel. She did physical therapy for that. She's seen her urologist, and nothing has helped. She's tried medications, and this was the one and only. And she was just kind of hopeless coming in. She's like, I'll give it a try. And I'm like, just trust me. And sure enough, it works. So, it doesn't matter. And we do a lot of the hormone replacement therapy in our office. So we're really big about sexual wellness. And that's also a big part of building and keeping your relationship strong. And just because you're getting older doesn't mean it has to just go to the wayside, right? And so this goes hand in hand with our hormone replacement therapy and vaginal lubrication and for erectile dysfunction for men. Exactly. Absolutely. It's not just for women. And that's what I really want people to understand. It's great for the blood flow, and we do the whole core to floor therapy by doing the M-Sculpt Neo on the abs, and then and also then the Emsella for the pelvic floor. And that really gets people feeling stronger in general, that you can balance you can balance better and just overall sexual performance.
Yeah. So it's funny that you mentioned that. The pelvic floor is actually something else besides the brake pads of the body. It's the bottom of the core muscles. And so if you can think of the core muscles like a pop can, okay, we all typically work out the outsides of the pop can by our Pilates and our yoga and that sort of thing. But the bottom of the pop can is your pelvic floor. And so that needs to be nice and stable in order to keep the entire core strong. So you can imagine a pop can, if it doesn't have the bottom of the pop can, it's pretty easy to destroy, right? And so that strength is really important. So yes, you have the core to floor to also, if we can think about a million different things that Emsella can do for you.
Right. And just another anecdotal story, we had a young male who, I believe he was just recently married, but then he had, prostate cancer, and it was really unfortunate. And, 1 in 8 men will get prostate cancer, and it's pretty high. And luckily, if you catch it fast, it's very treatable. But what they don't realize is the treatments then can cause other side effects like erectile dysfunction or incontinence itself. So incontinence is not just a female thing.
Right.
And so we have been able to improve their quality of life as well.
Incredible. So many options.
And we're all about limiting the number of medications our patients take, right? And most practices, when someone has urinary incontinence, the first thing they get is a medication. And so why not do something that's a non-medication way to treat the problem?
And most of those all just have side effects. I mean, they're drying agents, so you're thirsty. They interact with other medications. Sometimes they cause dizziness in my elderly patients. And then there's another one that works more on like a specific muscle, the detrusor muscle, but it's can cause high blood pressure. So if somebody already has high blood pressure, it can cause that to go up more. And so, this is all natural.
Yeah.
It
and
goes
again,
hand in hand with
works
our practice.
better than anything else that's on the market.
Absolutely.
Fully clothed, no downtime.
And there's people who get those stimulators or implanted as well. And unfortunately, they just don't seem to work that well.
Wow. Yeah. And that's one of our biggest problems with medicine today is most people aren't offered these choices and don't know they exist.
Right. Which was so important to you, I think, in bringing these sort of devices in to be able to offer your patients everything that you possibly could and to take care of them, again, holistically, send them on their way feeling their best without all of the side effects, without all of the downtime, and really just making sure that they get the best quality medicine possible.
Absolutely. Now I'm been waiting for this one.
Okay.
I'm ready to move on to M-Face. And, with everybody having the weight loss, we've noticed the quote unquote Ozempic face, right? And so when people are losing weight, we tend to lose the fat in the face and therefore droopy.
Right.
And when we start to see the jawline is disappearing, that makes us look older. So here we are trying to look younger and healthier and better by losing weight, but we actually are looking more wrinkled and older. Yes. So tell everybody about M-Face. How does it work?
Yeah. Great. So this is one of my favorite devices as well. So M-Face is, again, non-invasive, no downtime device. It's stimulating the muscle, keyword here that we're going to hear across the board. And so the stimulation of the muscle is actually lifting the face. And we have radio frequency as well, which is going to not kill fat in the face like it does for Emsculpt Neo. We're actually going to stimulate collagen and elastin. So we're going to give you that youthful bounce back to the skin, the elasticity back, which is going to eliminate fine lines and wrinkles. And so, yes, as you're saying, people with Ozempic face, as we're calling it, they're seeing some of that drooping. They're seeing some of the fat pads on their face disappearing. And so what we want to do is go in with M-Face and lift everything back up, put the volume back where we want it, get that jawline back, eliminate fine lines and wrinkles. And now, clearly, this isn't for just people who have Ozempic face. This is for anybody who's looking for that really youthful appearance and to look like themselves just maybe 10 years ago without surgery, without needles, without fillers and injections, that this is just going to give you that really natural bounce back.
And some people think that this does the same thing as Botox, but it really doesn't, right? It's almost the opposite of Botox. Botox paralyzes the muscles that pull your face down.
Right.
And this builds up the muscles that pull your face up.
That's right. Yeah. Elevator muscles and depressor muscles. So essentially what's happening is the elevator muscles are, all of our muscles really are, they're getting lax over time. They're loosening. They're starting to droop. And if you could see my hands right now sort of spreading apart, you can understand these muscles sort of loosening on the face. And so what M-Face is doing, it's not making the muscles stronger, right? We're not getting Arnold Schwarzenegger style muscles in the face. We're actually, quote unquote, shortening the muscles or pulling those muscles back together. And that's what's causing all of the lift for those elevator muscles. So the Botox and everything, great. But this is actually going to determine the foundation of the face, rebuild that foundation. And again, so it's you just a few years ago.
Right.
Right. So this is a new foray for you for sure, since M-Face really is more on the aesthetic side than anything else that you have. So what brought you over to the aesthetic side and what made you jump into M-Face?
Well, I love the term non-surgical facelift, right? And so many of our patients go for surgery and they're getting procedures done. And ultimately, yeah, most of the results look fine. But I always thought there's got to be better ways of doing these things that naturally can build up the collagen in your face. And we did talk earlier about the psychological aspect of health. If you don't think you look great, then maybe you're not going to feel great. And we can only do so much as to fixing your heart and fixing your cholesterol and decreasing your risk of Alzheimer's and heart disease. But at the end of the day, it's still about your quality of life and how you feel. So we thought that this was a good tool to bring on to help people feel better about themselves.
Yeah, I love that. And can we also talk about, for a second, mental health and the way that we feel about ourselves, what that does to our physical health?
Oh, right. So, I mean, if you're not feeling keen about the way you look, sometimes you just spiral downward. Sometimes I wish it was motivating, right? To look in the mirror and say, well, I'm not happy about this. I'm going to the gym.
Right.
But a lot of people aren't like that. They're like, ugh, just, and then they get down. So when you start to feel good and when you start to think you look good, it gives you more of a positive outlook on things. And then it kind of gives you that boost that people need, that kick in the butt.
Yeah, that snowball effect. And now we're going to do the next thing to feel better and the next thing to feel better and the next thing to feel better.
And kind of going back to even to like M-Sculpt Neo a little bit, I've had people who said, I've been in a rut with the gym and I'm going to use this as a jump start because they feel like if they're investing into their health that much with to get them abs, they want to continue it.
Right.
So you can look at it as either some people do it as a reward to tone up the work they've put in at going to the gym. And then some people are like, no, I need this to jumpstart me and get me back into the gym.
Yeah. Yeah.
And we used to always ask our patients, what's something you don't like about yourself? Or what's something that you wish you could fix? And, the answers that we wanted to hear back then were my energy or my losing weight, things like that. And then they would say things about their face. They're like, oh, well, we don't do anything about that. So now we do.
Now we do.
Absolutely.
And now the newest one that came out, which I'm pretty sure we have more candidates who are interested in this, is the Submentum.
Yes.
And so please tell everybody about this.
So
we were
excited.
so excited to have this.
So really quickly, just a couple statistics on M-Face alone. So M-Face was, when it first came out, was forehead and cheeks. Those were the applicators, and which lifted the entire face, right, along the jawline, basically jaw up. And so we saw 37% reduction in fine lines and wrinkles, which is absolutely amazing. 30% overall lift. So again, it gives you that non-surgical facelift. 20-minute treatments, so simple. And again, no downtime, so you're on your way. But we've just introduced the Submentum. The Submentum is the area underneath the jaw or the chin. So double chins, turkey neck, we're out here really looking for treatment for that area, but don't have many good options. So you have surgery, right? Which not very many people are willing to do or don't want to undertake that risk. You have a neck lift, which again, surgery, that's a lot. You have an injection that is supposed to go in and kill the fat, but the downtime from it, the side effects from it are just astronomical. And so now we have something non-invasive to actually go in, kill the fat in the double chin area and reduce all of the fine lines and wrinkles. We do have this muscle here called the digastric muscle that starts to, again, droop over time. So theme of the day, muscle. We're rebuilding and tightening that muscle to give you that really beautiful flush look along the neck and jawline area. So,
which you don't get when you have surgery or injections.
Correct.
They're not building that muscle to keep you tight. Right. And that's what people don't understand. It can still repeat.
We're fixing the root cause, the underlying problem.
Exactly.
Fixing the foundation of the face, right? We just, same thing with the face as far as facelift or PDO threads or any of those things. We're really just addressing the skin. We're just taking the skin, pulling it tight and stapling it there.
And hoping scar tissue forms.
Right.
And I'm like, oh, I don't know if that sounds right.
Yeah, exactly. And it doesn't look natural, right? Because all of the foundation is still in the same place. We've just tightened the skin over this strange foundation. And that's true of the neck as well, is that we're just tightening the skin. And so again, with M-Face actually being able to lift the foundation, shorten those muscles, give you back collagen and elastin, tighten the skin, everything happening at the same time to give you a natural look, that youthful look that's going to last over time.
The results have been amazing.
Yeah.
And it's just as little as 4 treatments, right?
Yes. And again, 20-minute treatments.
You can come in on your lunch break.
You can come in on your lunch break and be right back on your way with no downtime after, no anything that you have to avoid afterwards. You're not going to be red. You're not going to be sore. Nothing. It is amazing.
And we recommend that people go and look at before and after pictures because they're absolutely amazing. And the change is so drastic.
Yes. Yes. And so with M-Face now, including the cementum, we can mix and match areas, forehead, cheeks, and the cementum. Obviously, most people are going to want to do everything and get that full lift. So highly recommend, but you are able to treat those areas in particular that you're really looking for, like just the double chin if you need to.
That's amazing. And so tell me how the other day you said your protocol with the toning texture. So tell me about that, and that will kind of lead into the next
Yeah. So I call it tone, tighten, and texture. So we've got multiple different things that we want to address on our face. And so M-Face is great for that toning, right? So we're, again, rebuilding those muscles, putting them in place, and then we have some new options for tightening the skin and the texture of the skin with your brand new Exion.
Yes.
So again, this is another foray into aesthetics, and we can talk about how it kind of fits into everything you're doing, and especially semaglutide. So you've got a couple of things here. You've got radio frequency microneedling, which many people may be familiar with if they're out in the aesthetics world and getting treatments done. So we've got little microneedles that go into the skin and deliver radio frequency deep within the dermal layer to rebuild collagen and elastin, to break up scar tissue. So we're talking about deep fine lines and wrinkles, scarring, anywhere on the body, face and body as well.
Now that can also help with
pigmentation. Yes, exactly. Because we're going that deep dermal layer. Yeah. I was just speaking with someone yesterday about excessive sweating in the armpits and using microneedling for that. So we've got a lot of options, but really we're talking about texture here and that pigmentation, as you said.
And I know there's other devices out there for microneedling, but they're painful. So, and yours is not. So how is that? What's the difference?
Well, let's be clear. Ours is not painful, but it's significantly less painful. And I just want to be clear about that because we have little tiny needles going into the skin, and I don't want anybody to think that it's going to be nothing, but it feels much better than what's out there on the market.
So you don't have to go get numbed up for an hour before. Right.
Yes. So it's a quick treatment and you'll be comfortable. Couple of different things. The technology that we've created, not having to drive the needles as deep into the sensory nerves and still being able to deliver the energy as deep. So that's part of that less pain, if you will. And then the other thing is only having to do a single pass of the face or body, whatever it is, where other traditional RF microneedlings, you need to do it over and over again. So if you can imagine, it probably hurts a little bit to get some needles in the skin and then do it again in the same spot and then do it again in the same spot. Ouch, right? So now we've got a less painful delivery in the first place and only having to do it one time. So really incredible. The results are still absolutely beautiful. I will hold them up to any other RF microneedling on the market with significantly less pain.
And you can actually have this done anywhere you might have scarring. So like when people have had abdominal surgeries and they have that scar on their belly, or like a C-section for females, you can come in and we can really reduce that redness and that scarring. It's phenomenal.
Stretch marks, you name it. So we've got all of these opportunities to really go in for the texture and the pigmentation anywhere.
And acne scars as well.
Yeah, exactly.
So tell us about the RF.
Okay. So we also have RF ultrasound, targeted ultrasound. And so that is going to be the tighten part of the tone, tighten, and texture. So this is really looking at tightening the skin overall. So we can do, again, face, body, neck, décolleté, arms, legs, anywhere on the body to tighten the skin. And so this is delivering energy. Again, there are traditional devices out there that have some RF ultrasound, but we have created a different technology using multiple different energies to make it significantly less painful. I would dare to say that the RF ultrasound is almost pain-free. You have warmth, bordering on heat, but otherwise this thing is very, very comfortable.
I was going to say, I sampled it and I could have taken a nap.
Yeah.
It was comfortable. Yeah. I was like, oh yeah, just keep going.
Yeah, it's great.
Yeah.
And so, again, all of that skin tightening there. And again, so let's think about somebody who's lost a lot of weight, the semaglutide patients. We can tighten all of that excess skin that's around, right? With something non-invasive.
There's two areas on females that I hear a lot. The arm.
Yes.
They get that crepey skin after the weight loss. The skin was stretched out for so long that this can just tighten that right back up.
Yep.
I mean, it's not going to come all the way up, but it really, the results are amazing.
Yes.
And also right above the knees, when women are standing and the above the knees on the quad area, it can get quite wrinkly and lax.
Absolutely. And for a lot of women too, the abdominal area after pregnancy, that sort of thing. But anywhere you feel like you have a little bit of loose skin, just around the eyes or
you can do the
gelling,
lips.
you can do
so instead of getting your lips injected, you could just do it on the lips and you get a nice plump look.
And that's one of the things that makes our ultrasound different than others is that it is going to create hyaluronic acid. So 224% more hyaluronic acid in the body. Hyaluronic acid is a molecule that holds 1,000 times its own weight in water. And so when we're talking hydration and plumpness and fullness, which is what the skin needs, right? We need that hydration, that we are going to create that with the RF targeted ultrasound. There is no other device on the market that creates hyaluronic acid. And that's what's rebuilding the lips for you and giving you that injection look without the injection.
And there's one more device that we are excited to have in our practice, and it goes hand in hand with our sexual wellness.
Yes. So the FEM, that's another portion of the Exion device that you've received and that you are excited to introduce to everyone. So the MFEM treatment is a really quick, easy treatment with radio frequency that we can use both internally and externally for vaginal rejuvenation or feminine rejuvenation. So we can really rebuild collagen and elastin within the vaginal canal and make a sexual health experience much more beneficial to both parties involved. And then also the external rejuvenation for that skin tightening and feeling a little bit more youthful and happy in the way that we look.
The thing we found that was interesting is that it helps with lubrication as well.
Absolutely.
And we have a lot of our patients who are getting hormone replacement, and we've had patients who've had a history of cancer who cannot have estrogen. And we were always looking for another alternative to offer them, and here it is.
Right, absolutely. And lubrication in a bottle is, not the best option.
It can only go so far.
Right. So being able to have that spontaneity and be able to bring all of that blood flow back to the area, again, build that collagen and elastin and improve our sexual life.
So what is the future of aesthetics?
Yeah. And I think we've been touching on that the entire time. The future of aesthetics is wellness.
Yes.
Right? So the two of them hand in hand, that is what we are looking at for future. Aesthetics does not have to be a standalone. It does not have to be invasive. It does not have to come with all of this downtime. It can really be all about the wellness journey, the psychological journey, the health journey, that is what we're looking at for aesthetics, and you all are on the forefront of that. And I'm so excited for everything that has in store for you, because aesthetics is wellness now moving forward.
We're excited as well.
Good.
Thank you so much, Sarah. This was very informative, and I love always talking with you and picking your brain.
Absolutely. And patients can go to the BTL website as well, right? To help find a provider?
Absolutely. So bodybybtl.com to find a provider near you. That's where you're really going to find the people who have BTL devices, not any other little copycats that are on the market
And that's a problem. We've noticed that.
Yes.
There's many copycat devices that are not the same, not even in the same league.
Correct. And they may not be FDA approved. They may not be safe. They're certainly not efficacious. They're not tested for all of the same things. So make sure if you are going to look for a device like this, you're looking for a BTL device, bodybybtl.com.
Phenomenal.
Thank you.
Thank you.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.